Hello, everyone. The voice that you are hearing is that of Lily Mae with the Glambitious brand. And I am excited to interview Dr. Mitchell today. We have really received so much support from the Atlanta Fibroid Center over the years. And this is such an important discussion because, as we know, our health is our wealth. So, Dr. Mitchell, if you want to introduce yourself and tell everyone a little bit about who you are and what you do.
Well, thank you so much. I'm really happy to be here speaking with you today. Thank you so much. My name is Dr. Mitchell Ermintrout. I'm an interventional radiologist, and I work at the Atlanta Fibroid Center. I specialize in the care of uterine fibroids and treating women who suffer from symptoms of uterine fibroids, heavy periods, painful periods, urinary frequency.
And if you could elaborate exactly like what are uterine fibroids, what causes them, and why it's such an important issue for women.
Absolutely. Uterine fibroids are something a lot of people don't really know about, and I think that's one of the important aspects of our discussion today. Fibroids are very common. About 60% of all women have fibroids, and they're essentially uh, muscle tumors. So they're benign, but they're collections of extra muscle cells that are growing abnormally in the uterus. So the uterus is made up mostly of muscle. And so there's already those muscle cells there. And we think that what's happening is that from either genetics or some environmental factors, there's an abnormal response of some of those muscle cells, and they start growing into large masses that can start causing symptoms. And some of the common symptoms, like I was mentioning, really heavy periods, painful periods, cramping, bloating, um, pelvic pain that goes to back pain, urinary frequency. They really can be insidious and develop slowly over time as fibroids grow.
Mhm. And what got you interested in women's health and treating women with symptomatic uterine fibroids?
So it wasn't really something that I knew about really when I was going into the medical field. And I think that's the case for a lot of physicians. When I originally went into medical school, I had different ideas about going into pediatrics. I thought about surgery. And when I started out in medicine, I discovered interventional radiology, which is a really fascinating field. And what we do utilizes imaging, so X-ray, MRI, CT, ultrasound, all the different imaging modalities to treat patients in a less invasive way. And so we can use that high-tech imaging to replace surgical procedures or other more invasive procedures and treat conditions like uterine fibroids in ways that allow women to have a less risky procedure with fewer complications, faster recovery. And UFE or uterine fibroid treatment isn't the only thing that we do in our specialty. There's actually quite a few different procedures. We deal with all different types of medicine from the gastrointestinal system, the nervous system. There's kind of a lot of different types of procedures. When I started out my career in interventional radiology, I was working at Emory and spent a lot of my time teaching. So teaching residents and fellows, other doctors learning interventional radiology, and spent a lot of time honing skills in different aspects of our specialty. Um, as I've moved along in my career, my focus has really changed towards patient care. And I discovered that, being able to sit with patients and really understand what's going on and offer them a treatment that can really be life-changing, is a really great opportunity for a physician. And so I've had this opportunity here at the Atlanta Fibroid Center working with Dr. Lipman, where we really can focus on patients and deliver care that is potentially life-changing for a lot of women.
Yes, absolutely. And one of the things that I have learned from Dr. Lippman is that a lot of women get hysterectomies because they don't know about UFE. And so oftentimes it's a popular recommendation, by other doctors for them to do that when there's this alternative route. So could you kind of elaborate on why that's the case, or, why is it that hysterectomies are pushed upon women that suffer from fibroids?
Absolutely. It's really unfortunate that the vast majority of women who come to their OBGYN with symptoms of fibroids, all the things that we talked about, um, are, are frequently only given the option of surgery. And, for most of these women, surgery is a really big deal. Going under the knife, under general anesthesia, having the uterus removed, or in some cases, having another type of surgery called a myomectomy, which is still an invasive operation to remove fibroids. But either one of those surgical options are usually the only potential options given to lots of patients. Um, Part of it has to do with the fact that gynecologists do those surgeries, and they're the ones who initially see these patients. And there is efficacy of those procedures. But what we've discovered over the last 25 years since UFE, or uterine fibroid embolization, has developed is that we can treat uterine fibroids in a much less invasive way that has all the same benefits of symptomatic relief without all of those risks with surgery. And so there are some patients who are unfortunately not told about UFE. And one of the things that we strive to do is to improve patients' understanding of their options, to help them really understand that there are alternatives to surgery, because not every woman has to have that. In fact, the majority of women who have uterine fibroids are candidates for uterine fibroid embolization, and they don't have to have their uterus removed if they don't want to. In fact, having the uterus removed does lead to some other unwanted sexual side effects, mental health side effects. There's risks associated with the surgery itself, which can lead to infection, hospitalization, um, sometimes damage to the bladder. Those complications aren't necessarily common, but they're risks that most women don't want to have to take if they don't have to. And so, we hope to improve understanding of other options. And, in general, that's what our specialty is all about. So outside of uterine fibroid embolization and UFE treatment, interventional radiologists are offering other less invasive options for other things. But at our center, where we focus on women's health, what we're trying to do is help women understand that this really is a great option for them, and at least for the majority of women that are potential candidates, that they can have a less invasive treatment.
Absolutely. I've actually referred one of my very close friends, and she's in North Carolina, but she traveled to Atlanta to have the UFB procedure done at the Atlanta Fibroid Center. So she was very pleased. And I'm always, loving the opportunity to introduce this option to women so that they know that they do have options. And how would someone determine that they're a candidate for UFE?
So anyone who's having symptoms, like we were describing, those heavy periods, painful intercourse, needing to urinate frequently, constipation, bloating, pelvic pressure. And for the patients who have heavy bleeding, they may have symptoms of anemia, and that's where blood counts are low, and they may be tired all the time, chewing ice due to low iron, um, headaches, lightheadedness, dizziness, um, feeling like heart is racing. There's quite a few different symptoms that exist. Any of those, should lead women to, reach out to usually their OBGYN first, for evaluation. It's appropriate for women to have a regular checkup, make sure that they're up to date with their pap smears and that they've had an evaluation by their OBGYN. But for women, who are thinking about treatment and have symptoms that are, warrant, something, some type of treatment. If they're not being offered a non-surgical treatment like uterine fibroid embolization, those types of patients should see an interventional radiologist, like Dr. Lippman or myself at the Atlanta Fibroid Center, where we can evaluate all the different types of symptoms they're having, but also the fibroids themselves. So what we typically do is do a pelvic MRI. That way we can really characterize the fibroids. And when we see patients in consultation, we actually review that imaging with them in person. So we spend some time understanding the symptoms that they're going through, and then also trying to compare those symptoms to what we're actually seeing in the imaging to make sure that what we're seeing actually makes sense and that it's related to their fibroids. There are certain types of fibroids that can't be treated with uterine fibroid embolization, so we're also looking for those. I'd say that's a very low number. The majority of women are typically candidates, but what we're doing is trying to make sure that the types of fibroids that they have would respond reasonably to treatment, and that they don't have any that are, have other risk factors that would maybe best be treated another way. So we're trying to really tailor treatment specifically to every patient so that when we're offering a UFE treatment to someone, that it really makes sense for them. But also what's most important is that we discuss all of the options. So I like to spend time with every patient, helping them understand what it means to go through a UFE procedure, how that's different from a surgery, and how they would, what the pros and cons of each of those would be. For some patients, there's medical therapies that may be options, and allowing patients to really choose the procedure or treatment that's best for them, I think is the focus that I have, and we try to do here at the Atlanta Fibroid Center.
Indeed, indeed. And do you find that there's a particular age range that this affects more than others? Or because I know that, there are women who want to have children, so are they candidates? What is kind of that range?
Absolutely. So, fibroids grow in response to estrogen. So throughout a woman's life, with each menstrual cycle, and the presence of estrogen going up and down, there's opportunity for fibroids to grow and grow. And so they typically start to become an issue when women reach their 30s and 40s. We do sometimes see it in women in their 20s, and we sometimes also see women who are close to menopause or have even reached menopause and are still having significant symptoms of fibroids. So the range is pretty broad. I'd say from around age early 20s all the way through 60s.
Oh,
But the vast majority of patients that we see are still in childbearing age, or either have had children and maybe want to have another, or have not had children and still want the opportunity or the possibility of still having children. So thinking about fertility with respect to fibroid treatment is really important, and so we certainly take that into consideration. So when I talk with patients about what their options are, we always discuss that when we intervene with the uterus, there's always some risk of affecting fertility. Anytime you would do an operation like a myomectomy surgery, which is an operation where a surgeon goes in and tries to remove the fibroids individually, there's risks of causing infection or scarring, damage to the fallopian tubes. That surgery itself can have an effect on fertility. Uterine fibroid embolization similarly does have some temporary effect on the uterus blood supply. But what we see in general is that with both procedures, there is recovery of the uterus, and the majority of women, when this has been studied for patients who have had uterine fibroid embolization, the majority of women who wanted to get pregnant were able to. And so there is a significant understanding that pregnancy is safe after uterine fibroid embolization. We also know that it's safe after myomectomy, although patients who have a myomectomy surgery typically have to have a cesarean section if they have a pregnancy afterwards. Whereas patients who have a uterine fibroid embolization may still have the option of having normal vaginal delivery. There have been some additional studies that have compared the two options, the surgery option and the UFE option. So patients were split into two different groups. This study was done in the United Kingdom. It's called the FEM trial. And they looked at the pregnancies that happened in each group afterwards, and there were about similar rates of pregnancy in each group. There were actually more pregnancies in the UFE group, but it was not significant enough to say that there's a difference. But the current research, what we understand is that for women who are still of childbearing age or interested in fertility, that UFE should be considered an option for them. And specifically women who have lots of fibroids. And if they were to undergo a surgery and need to have many fibroids removed, that the risk of that operation is actually pretty high. And so for women who have many fibroids, UFE is potentially a better option for them. So these are all things that I'll typically talk about with patients who are undergoing a consultation and may have questions about that, and we identify that they're considering fertility.
Gotcha, gotcha. So, in closing, if you want to share what makes the Atlanta Fibroid Center unique and how people can connect with you for like a consultation or, what the next steps would be to find out more information, please share that.
Absolutely. So our center um, is really a fantastic place, and I think that the most important thing about it is really the people and the fact that we strive to really have a patient-centered focus when we're helping patients set up their consultation, when Dr. Lippman and I are speaking with patients and helping them understand their treatment options, and then all the way through the actual treatment day when they come in for their procedure, and are have extra attention from our nursing staff, and then go home for their after procedure recovery at home. We really focus on patient comfort, being attentive, and really focusing on that patient-centered experience. Now, another thing about the center here is that we do have a really amazing setup in terms of the imaging system that we use, which is pretty atypical for an outpatient center. We've got equipment that is similar to what you would find in a major medical center, and that really enables us to do this procedure in an outpatient facility, but also have the same imaging quality that you would get at any major medical center. And imaging quality is really important and helps us be more specific and make sure that the procedure is tailored specifically to the patient, and that the quality of the treatment is as best as it can be.
Wonderful.
Yeah. But we do invite patients to reach out to us. We've got a lot of information on our website, which I think is a really great resource for patients around the country who are interested in uterine fibroid embolization, have questions about the treatment or other aspects related to UFE. Our website is atlii.com. Dr. Lippman also has a lot of information on his Instagram, which is Dr._Lippman. We have really an amazing treasure trove of educational information also on our YouTube channel at the Atlanta Fibroid Center.
Awesome, awesome. So again, viewers, make sure that you visit atlii.com for more information, because again, our health is our wealth. And as entrepreneurs, we definitely want to stay on top of our health because we are at the forefront of our business, of our vision, and of our destiny. So thank you so much, Dr. Mitchell, for coming and sharing so much insightful, information to educate us, because I definitely think there are a lot of myths and confusion around, what fibroids are, what it means, how it can affect women and what their options are. And UFE is definitely a much safer option for women. So again, I'm always so excited to support the Atlanta Fibroid Center, and I love the work that Dr. Lippman has done over the years. And it's a pleasure to meet you as well, as help women with their plight with uterine fibroids. So thank you again. And again, viewers, please visit atlii.com and share this information with your friends, with your aunts, with your nieces, so that more women can be educated about their bodies and what their options are. So thank you for tuning in. This is Lily Mae signing out.